Hi everyone, Dr. Orit Hickman here from Pain Science Physical Therapy. I wanted to put this video together to address a question that came across my YouTube channel about stenosis in the spine. So stenosis is a term, it's actually an anatomical term in the sense that it is describing something that is seen on an image, such as an X-ray or an MRI. And it doesn't actually tell us very much about what's happening in terms of somebody's pain or function. Every single nerve in your body travels through holes or areas. Your spinal cord travels right through the center of a large hole, and then the nerves that come off of the spinal cord at every level travel through holes that are formed by the shape of the bones. And nerves really like blood flow, they really like movement, they also like to have a lot of space. And what can happen is that through different changes that occur in the body, starting in our 20s, those holes can get a little bit smaller. So what does that mean? If you have some arthritic changes and the shape of your bones have changed, then you could have a little bit of decreased space for the nerve to travel through. That is known as stenosis. There is a little bit of a change in the shape of the hole. It's making it a little bit smaller. That in and of itself is not a big deal. That can occur, again, an arthritic change in the spine can change the shape of the holes and make them a little bit more stenotic or have a little bit of stenosis in them. Also, if you have bulging discs, also very common starting in the spine in our 20s, if you have a bulging disc, that can go into that area where the spinal cord travels and could make that area a little bit smaller. So then you have a little bit of what's called stenosis. The concerns with stenosis are if you are experiencing a very large amount of stenosis that could potentially lead to a lot of compression on the spinal cord or the nerves, and then it could lead to pain and even changes in how the nerves function. So we worry about things like muscle weakness or loss of sensation, the ability to feel touch, vibration, sharp versus dull, hot versus cold sensation. I will tell you that I have been treating patients for 26 years, and there are a lot of times where patients come in and they're very concerned about findings on an image that show that they have some mild to moderate stenosis.